Welcome back to the Southern New Hampshire Health Podcast. I'm Steph, and today I'm back with another special guest. Katie has an interesting story, and my hope is that this episode brings more awareness towards tuberculosis, especially in New Hampshire. Welcome to the show. Why don't you start by telling us about yourself?
Hi Steph, thanks for having me today. To start, I contracted TB in 2016 when I became homeless. I was laid off, losing insurance benefits. As time went on, I lost my home and didn't have any support and ended up on the streets.
Just so the audience knows, tuberculosis is contracted when an individual inhales airborne droplets containing Mycobacterium tuberculosis in a poorly ventilated environment. Once in the body, it wreaks havoc on the respiratory system, initiating an inflammation process that causes lung tissue necrosis, resulting in lesions. While some lesions heal, if left untreated, the bacteria has the ability to spread to the brain, spine, and kidneys, causing irreparable damage. So, Katie, what do you believe are some of the important factors that contributed to your illness?
I do not think I would be in this situation if I had not lost my job. Beforehand, I had excellent health insurance, saw my PCP once a year, and was able to afford medications. That was taken away from me when I was laid off. Nashua is a highly populated area, and you see a great variance in socioeconomic status. On the east side of the city lay the projects and poorly developed housing communities. It's not uncommon to see violence, drugs, and homeless people flooding the streets in this area. But not even 10 to 15 minutes down the road, heading west, million-dollar homes sit on well-maintained lawns with BMWs in the driveway.
So, do you believe that this issue was based on your lack of access to healthcare?
Not necessarily. Disease is not contracted from one factor alone. There are numerous circumstances that interact to affect one's health. There are a few shelters in Nashua, but most of them were packed full. People in these shelters were in close quarters with one another, making the transmission of infection and diseases more likely, in addition to the inadequate hygiene. By being homeless, I'm at a significant disadvantage in comparison to the general population, financially, mentally, and physically.
Tell me more about the shelter you went to.
I went to Greater Nashua Mental Health Center, where individuals who are struggling with homelessness can find the care that they need, in both physically and psychologically. Services offered by this program include case management, illness management, community support counseling, housing outreach, supported employment, and educational services. Eligibility for this program requires a lack of housing, contract for participation in treatment and services, and remain free from substance misuse.
That's incredible. The New Hampshire Health Improvement Plan outlines recommendations for action regarding tuberculosis from the local and state government levels to the individuals and families affected. According to this plan, it is up to the state and local governments to increase the delivery of clinical preventative services, creating systems that allow for the exchange of clinical, public health, and community data, decreasing the time it takes to facilitate access to healthcare and other social services. Do you have any advice for healthcare workers who may care for homeless people or those infected with TB?
In order to control the outbreak of TB within Nashua, homelessness must be addressed. A key concept to understand that prevention is much more efficient in comparison to emergency care. If a community nurse were to initiate primary prevention strategies for homelessness in Nashua, government involvement is necessary for provision of affordable housing, reducing poverty, and prevention of the use of addictive substances. Secondary prevention includes alleviating existing homelessness by making referrals to the financial services, food assistance programs, and health services, and assisting clients to meet long-term needs. A nurse may reach out in social services for the patient, fulfilling the role of advocate in case management. In regard to TB, primary prevention revolves around education regarding infection control, hygiene practices, and immunizations. These services can be offered by a community nurse. Secondary prevention includes screenings and early diagnosis. For example, a community nurse can hold tuberculosis skin tests at a local homeless shelter. Tertiary prevention includes the identification and control of TB once it is made known. A nurse can do this by providing supportive care, antibiotic administration, and isolation precautions.
Thank you so much for your input today. You have highlighted some important issues regarding the health and wellness of Nashua residents. It looks like that's all the time we have this week. Thank you again, Katie, for joining us. Tune in again next Friday where we discuss the consequences of vaping on health. Stay healthy.